Good morning, everyone, and welcome to day 2 of the Rare Patient Advocacy Summit. Thank you for joining us, and this is track 1, Living with a Life-Altering Condition, sponsored by Horizon Pharma. My name is Robin DeLeon, and I will be your track host for this morning's sessions. I would also like to welcome those of you that are joining me through the live stream and would like to remind everyone joining us to download our mobile app in order to use some of our highlighted features in the live Q&A. Today we'll be joined by Allison Fine, and she's the founder and executive director for the Center of the Chronic Illness, and Seth Rotberg. He's the board member for the Huntington's Disease Youth Organization, who will be diving into a deep discussion on the challenges that so many of the rare disease patients share and what resources and tools may be available to help thrive. And during our session, understand the emotional health and rare disease patients. So let's welcome them.
Yeah, I'll go first. Good morning, everyone. So thank you, everyone, for coming to our session. To just start us off, we are just going to make this very conversational. We want to make sure it's more informal and not us just talking at you. But before we get started, I will also read this slide of disclosures. We have no actual or potential conflict of interest in relation to this program/presentation. Oh, that would be helpful. Thanks. So I'll introduce myself. Perfect. So my name again is Seth Rotberg. I am a rare disease advocate and patient. If it's easier, I can also stand up. Cool. I'll stand up. Perfect. I like walking around anyways. I'll work the room. So I tested at the age of 20 for this rare neurological disease called Huntington's disease. It's kind of like having ALS, Alzheimer's, and Parkinson's all at once. There's no cure. There's very little treatment. My mom had it for 17 years before passing away, and I continue to just try to live one day at a time. And so I sit on the board for the Huntington's Disease Youth Organization, also known as HDYO. We provide social, emotional, educational support to young people worldwide impacted by Huntington's disease. For my career, I am working for a health company called Inspire, and my role there is partnerships manager, working with community partners.
Hi, everyone. Thanks so much for being here. So my name is Allison Fine, and I'm a clinical social worker by schooling and license and practice, I should say. So I live in Seattle, Washington, and have worked in private practice with folks with chronic health challenges for the last 9-10 years now. And then in the last few years decided that there were just not enough supports emotionally for folks who live with chronic health challenges, and decided to start the Center for Chronic Illness. So we're a small nonprofit, I'll just say briefly, that offers free, professionally facilitated support groups, both in Seattle. We have 6 groups locally in Seattle, and then we also offer web-based programs that we just started last month. And I do have some flyers up here for our rare specific support groups that I'm happy to pass out if folks are interested, or you're welcome to just come up and grab one afterwards. I guess I'll add to that really quick. Sorry, Seth. I also live with a chronic illness. It's not a rare chronic illness, but definitely something that's helped me understand more what patients go through as well.
Boom, boom. Let's do it. So for today's topics and format, as mentioned, we're going to kind of talk about different types of emotions: grief and loss, depression, anxiety, impact on family, stress and other factors, and then finding support and resources. So as mentioned, we're just gonna, what we ended up giving you guys are a list of the questions we're gonna review and go over. Some of them Allison will answer, some I'll discuss based on my personal experience, and then we'll leave some time at the end for some Q&A, and feel free to ask any type of questions. Nothing is too personal, at least for me. So I'll talk on my behalf, but any question, I'm an open book.
So we're going to get started with grief and loss.
Yeah. So, Allison, what is grief and loss as it relates to living with a rare disease?
So sorry, I'll stand up again. I don't want to block the screen here. And actually, I think the reason we gave you the questions was because we wanted to land on some of the pictures that you could just have a nice visual while we're talking. So grief and loss, oftentimes when folks think of grief and loss, they think of the emotional process that somebody goes through when they lose a loved one. And this is actually very similar to what someone experiences when they're going through some kind of loss within their body or within their life. And so, typically we think of grief and loss as the 5 stages of grief as defined by Elizabeth Kubler-Ross. She was kind of the grief and loss guru. So the first one is denial. The second one is some sadness or depression. The third one is bargaining, anger, and acceptance. And they don't all go in that order, and not everyone experiences each one. For those of you who were in the session yesterday, they also talked about a couple additional stages of grief that have been defined by other clinicians since Elizabeth Kubler-Ross developed her model. But really, again, grief and loss, and I might jump into the second question that's on your sheet if that's okay. So when folks live with rare disease, often the kinds of losses that people face might be physical or cognitive. They might have abilities that they used to have that they don't have anymore physically or, again, cognitively. For other folks, it's about loss of sense of purpose of their life or what they thought life was going to look like, and now things look a little bit different after being diagnosed with a rare disease. So there are just a lot of losses that can come about. Again, for other people, sometimes it's about loss of career, loss of relationships. And again, all of us go through loss in our lives, but when you're living with a rare disease, it's even more impactful because the losses can be ongoing.
And just going off of that, so based on my personal experience, as Allison mentioned, it's not just about grieving over a person you lose in your life, but when I was growing up with Huntington's disease in my family and dealing with my mom, I had to take on additional responsibilities. I had to grow up a lot faster than my friends. I felt like I lost out on that normal childhood, that teenage experience that all my friends were able to do. And more importantly, I felt isolated. I had no one to talk to about this. I was kind of on my own island, and it was just very challenging every day to try to accept that as part of my life and what it's going to entail for my future. In addition to that, though, I felt like I lost my mom twice. I lost her the first time to the disease, and that was very tough because, again, it wasn't my mom. I felt like I was just dealing with Huntington's disease all the time. And then the second time was when she passed away 3 years ago. And it was very tough because my friends and family obviously were very supportive, but they would say, Seth, just think about the memories you had with her. Yet all my memories I could think of in my head were the memories when she was sick. But fortunately enough, I talked to my mom's brothers and sisters, which were my aunts and uncles, just to hear about those stories of my mom, to hear about what she was like, to get that details of who she was before this illness took over her life. And no matter how tough dealing with Huntington's disease was growing up, and it still is very tough, it really shaped me into who I am today. I'm a person who wants to always continue to help others, to connect people with each other. But more importantly, it made me understand that life is too short. You can't take anything for granted because, yes, I lost my mom, but I also lost a few other close friends at a young age, and it just made me appreciate life a lot more and try to take life one day at a time.
Seth, can you tell us a little bit about any positive experiences that might have come out of your grief?
I mean, as just mentioned, I think just on top of that, just being more involved within my own community, but then also understanding how to get more involved in the rare disease space as a whole. It was very powerful to be just here in front of all of you, but also connecting with all these other people and having this opportunity to not only share my story, but hear other people's stories and how we relate to each other, how we connect. And I think just being open with others, especially being okay during these tough times, is very powerful, and it's very important to take care of yourself.
So our last question about grief and loss here talks about if you're experiencing loss as a result of living with a rare disease, what do you do? So, that's, I think the most important thing to know about grief and loss is that it's really a normal human experience to go through that grieving process when you do experience a loss. But there can be things like anticipatory loss, so grieving before a loss actually happens, or complicated loss, multiple losses on top of one another. And so if you feel like you're experiencing some of those, it can be helpful to talk to a professional. There are a lot of grief counselors out there who would be able to kind of help navigate through that if you feel like your grief is so significant that you can't quite cope on your own.
Yeah, and just in addition to that, for me, I was able to connect with close friends, with family, and then even people within the Huntington's disease space, those that are impacted by a rare chronic condition who understand what I'm going through. It's a lot easier sometimes to diversify who you talk to, so you have different perspectives, different angles. But I also, always try to challenge myself to accept being vulnerable. It's something that still takes time to acknowledge is, hey, if I'm having a tough day, rather than what Mike from the Mighty mentioned yesterday, rather than saying, how are you doing? I'm good. How are you? It's saying, hey, I'm having a tough day, and do you have some time to chat? I think that's important to acknowledge those times to say, actually, I need to talk to someone, and I need to figure this out, and I need to figure out what resources I need so that I'm feeling okay.
Sure. Is it that one? Yeah. We do have more handouts. Did everyone get a handout of the questions? No? Okay. Yeah, we do have some more.
You can raise your hand and I'll pass you out one.
Thank you so much. Yeah, so if you have the handout, it has all the questions on it, but if it's more accessible to see them up here, we're happy to leave the slide up here too.
All right. Okay. Now we're going to dive a little bit deeper into depression. So, Allison, give us the good old scoop of what is depression.
Yeah, so I'm just going to say first, in hearing us talk today, it's not at all a way to diagnose your own symptoms. And so if you do feel like you're experiencing any of the things that we're talking about and need more support, in order to have a full diagnosis, it is really important to see a professional. You can see a medical doctor, you can see a therapist, you can see a psychologist. So we'll talk a little bit more about that in a bit, but just wanted to kind of give that caveat before I talk a little bit about some of these more clinical words. So depression, it can exist on a continuum. It can be something that people experience kind of low moods and feel like they're able to kind of pull themselves out of that, or they don't exist in that emotional space for very long, while other people can experience a more clinically intense depression that kind of goes on throughout their life, or they have periods of throughout their life. So, what is depression? It's feelings of sadness, feelings of loneliness, can be feelings of isolation. There can be anger, irritability with it. There can also be physiological changes. You can notice loss of appetite, or you feel like eating all the time. You can notice things like sleep difficulties or loss of interest in activities that maybe you used to enjoy that don't feel enjoyable anymore. There can be kind of an apathy that comes along with it, like nothing really feels that enjoyable anymore at all. Some folks can also have suicidal thoughts. So yeah, that's probably a pretty good overview of it. And again, it really exists on this continuum. Some people have some of those symptoms, some people can have all of them, some people have an intensity of those symptoms, some people have more mild symptoms. So it can be really important to talk to a professional to kind of determine how much is this impacting your life if you are experiencing depression.
And to go on to the next question, I'm going to kind of dive deeper into this one about the type of support should someone seek who may feel depressed. at the end of 2017, so last year, I was in this dark place, one of those places no one ever wants to go to, where I would wake up and not want to do anything. I would just lay in bed and say, I don't have any motivation. I have no energy to do anything. I wasn't feeling myself. Although I wasn't suicidal, I thought to myself, what would life be like if I wasn't here? Or what would life be like if just I was gone? Would people care? Would people miss me? Would there be maybe a Seth parade? I don't know. But these were things that were, I would have a Seth parade, maybe. But these were things that were always just on my mind, and it got to the point where I was in this funk and I didn't know how to get out of it. I spoke with some friends on the phone. They said, try to keep busy, go to events, do activities, hang out with friends, try to keep your mind off of Huntington's disease, but it was just so tough to do. And then fast forward to right after the new year, I was talking to one of my good friends, and I said, I'm in this funk, and I don't know what those next steps are in life. And the best advice that he gave me that sticks to me to this day is, he said, Seth, you got to find your purpose in life. It's not going to happen overnight. You have to have a lot of patience. But everyone on this earth is here for a reason, and that you need to just find what's going to make you happy and make you who you are, not just by who you are by the disease, but who you are as a person. And that really just resonated. And that's something I needed here to kind of get out of that funk, to say, okay, what are the steps I need to take to find my passion, my purpose, and just go with it and just continue to live life with enjoying every day.
So this is kind of a question for all of you. Are there people in your own support systems that you feel comfortable talking to when you're having a harder time? And you don't have to answer that now, but you're welcome to. I think, as Seth is saying, it was so important for him to have this friend that he felt like he could reach out to and talk to when he was having a really difficult time. Somebody that didn't judge him, didn't question him, but really understood what he was going through and offered helpful suggestions. And sometimes suggestions are helpful. Sometimes you just want somebody that will listen to what you're going through. But it really just depends on kind of who you are and what you're looking for as far as that support goes. And it's kind of helpful to know that about yourself, what you need when you do look out to your friends or loved ones for support. But I think it's a great example that Seth gave.
Yeah, and just making sure that you have that support system is very important. Again, it could be close friends, it could be people that you met here at Global Genes, it could be family, but it's okay to tell them that you're having a tough day, or telling them that you just need to talk and just have them listen to you vent. I mean, I'm a big talker, so I try not to go to the same person every time, because I might talk their ear off. I mean, one of my friends who's in the back right there, BJ, I'm going to call you out, but he's one of my good friends who I will go to when I need to connect with someone, and I try not to go to him all the time, just because I don't want to make it too much on him and feel that sense of need, even though I know that I can always rely on him as a friend, as a support system. So it's good to have people that you can connect with, who you can rely on, and just there just to chat, whether it's about the disease or it's about just life in general. Allison, could you kind of dive into what should someone do if they think they might be depressed?
Yeah, absolutely. So if you think you're experiencing feelings of depression, one of the things we look for clinically is what is the impact on somebody's life? If you feel depressed, you're not getting out of bed in the morning, you're missing work or school, you're not able to engage in activities that you used to enjoy, then absolutely it can be really helpful to talk to somebody about that, talk to a professional about that. For other people, you might notice ups and downs. You might have a more mild form of depression where, you notice a small impact on your life, but you're still able to kind of do day-to-day activities, and you push yourself a little bit to do that. And once you're kind of out and about, you feel okay about that. So yeah, it really just depends on the person. But I think if you have any question in your mind that you might be experiencing depression, it can be really helpful to talk to somebody who understands what you're going through, and either a neutral person or even a friend, but also be able to get a diagnosis, perhaps go to therapy, get on medication, engage in an exercise routine, whatever it is. There are a lot of different things that have been shown to help with depression, kind of depending on what level of depression you're experiencing. Sorry, we're trying to multitask up here. Yeah.
Cool.
Yeah, I think we're just going to leave the questions up. That might be easier for all of you to follow what we're doing here. So I guess I'll start off and talk a little bit about what is anxiety first. So anxiety, as with depression, is on a continuum. Sometimes it can be confusing to distinguish between what is anxiety and what is depression. So again, depression is kind of this sadness or malaise, whereas anxiety is more about fears and thoughts. And it can be a physical experience as well. So for some people, anxiety is about kind of racing thoughts or worries about what's to come or what's happened in the past. For other people, it can involve some physical symptoms. For some folks, when they get anxious, they get sweaty or, again, notice kind of a heart racing. And for other people, as the anxiety intensifies, they can go into what are called anxiety attacks or panic attacks. And so it can be really helpful to, again, talk to somebody if you feel like you're having really intense anxiety, or again, if it's impacting your day-to-day life.
And to address some of the fears I've faced, especially since I feel like I live every day with anxiety of some sort, it was several things went through my head. One was the reason why I got tested at the age of 20. I didn't want to live with the unknown. I like to plan. I'm a planner, so I need to know what the future holds and what I can do for that. But there is also that fear of time. How much time will I have until I'll get sick just like my mom? Who's going to take care of me? Will I have someone to rely on? These are questions I was thinking about. And then just on family planning, will I have a family? What type of family? Do I have to make sure that I'm financially stable for them when I get sick? These were just things that were always on my mind, but I was always racing. I felt like I was always racing against time. I would feel like, okay, I have 13 more years until I may show symptoms. I now have 12 years, 11 years. And then I would have to remind myself that I can't look too far ahead in the future. I have to pull myself back to the present. But it was tough because there's not only those fears, but the fear of judgment. I remember just being out in public with my mom, and because she'd have these physical, movements with the poor balance and the wobbly movements, people honestly gave us just these looks because they didn't understand it, rather than simply just saying, "Oh, is your mom okay?" We'd have neighbors who thought my mom was drinking during the day, but it was just because of her physical symptoms. Eventually, I'm fearful that people could be looking at me differently just by me saying, "Hey, I tested positive for Huntington's disease." They Google it. They say, "Wow, this is scary. See you later. I don't want to deal with you." I've dealt with that personally, and it sucks. But I realize those are the people that shouldn't be a part of my life to begin with. We got to surround ourselves with those people that understand us for who we are, not defining us by the disease, but who we are as a person.
I'll add just a couple things to that. I think in general, for folks who live with rare disease, there can be a sense of fear of just unknown, again, like Seth's talking about, when will the symptoms come? Or if you're already having, experiencing your illness, will it get worse? I think there can also be a lot of fear, particularly for rare disease folks, around, will there ever be a treatment for me? I know that for a lot of folks that there just aren't treatment options out there. I think also there can be worry about the financial aspect of living with a rare disease or chronic illness in general. How can I afford this? Will I have to work more? Will I have to, it worries for the whole family, especially, how will we afford to take care of our loved one if they get sick or sicker? So I think, just to kind of piggyback on what Seth said, there would be some additional worries like those as well for some folks.
And can you touch upon kind of skipping down to that third question, like the types of strategies or treatments for someone who is experiencing anxiety?
Absolutely. So there are a lot of things that have been shown to be helpful with anxiety. There's things like cognitive behavioral therapy, so becoming more aware of your thoughts and then being able to change your behavior as a result of being aware of those thoughts. We've all probably heard the word mindfulness at this point. It's kind of a popular buzzword around being able to cope, and there's some shown research benefits of using mindfulness to cope with things like anxiety, but also things like chronic pain, which can increase anxiety as well. A lot of strategies, treatments available, breathing exercises, meditations, secular or religious. There are just a lot of things out there that can really help folks find more ease and peace in their lives. And so I definitely recommend you don't necessarily have to see a health professional to access some of those resources. The UC San Diego has a great website about their mindfulness trainings and programs and some free recordings on there. There's some, I would just let you know there's some resources out there that are breathing exercises or meditations that are evidence-based practice and some of them that are not. I tend to say to my clients, it doesn't really matter. It's whatever's helpful to you, whatever helps you feel more at ease. Just to put that out there as a caveat.
And for that final question, the type of support someone should seek if they feel anxious, especially myself, what I realize is that there are specialists out there. There's people who specifically specialize, whether it's in anxiety or depression, because when I was growing up and going to therapy, most of the time these people were just so focused on understanding Huntington's disease or learning more about my mom, and kind of giving that look of being like, yeah, I'm right here. My mom's not even here. I'm paying you to now tell you more about Huntington's disease, not just about what I need. So eventually what I found out is, you can go to a psychiatrist who specializes, again, in anxiety or depression, or maybe someone that specializes in your specific health condition. And talking to them and understanding and building that relationship, I think, is very special and something that if you have that opportunity, definitely take advantage of it, because it just makes that process a lot more manageable than trying to go to some stranger and then you're only talking about the disease and not what's on your mind and what you're feeling.
I would echo that for sure. Make sure that if you do try to seek out a professional, that it's somebody that you really feel comfortable and safe with. I think as a therapist, the most important thing for me is that my clients feel safe when they're talking to me. And so, I've heard stories from folks that, there are places where they don't feel so safe. And so again, not everyone's personalities match up. Not every client that's ever come to see me has been the right fit. And so, I think, as Seth is saying, it's really important to find the type of provider, and we'll talk a little bit more about that towards the end. Also the individual that works for you.
So we'll briefly touch upon this. We found it very important for this session, but we know that there is a whole other session strictly on the impact on family. But the types of challenges families face when a loved one lives with a rare disease, it really depends. For me, it was, like I mentioned before, taking on that additional role in the house, taking on additional responsibility, being a parent to my parent. These are just things that I had to deal with growing up. And now the impact it has is it's different in a way, because now I'm more open with my family about testing positive and experiencing struggles. But it was definitely stressful growing up. It was challenging, mixed of emotions of just anger and frustration for this happening in my life. What did I do to deserve this? What did my family do to deserve this disease? And just not wanting to understand it, being in denial, and not trying to accept it for a long time until realizing that it could impact my life one day, and I can either, run away from the situation, or I could tackle it head on, which is what I decided to do.
I think the thing that I would add to that has to do with how each of us cope as individuals. So, if you're part of a family or if you have loved ones that are involved or impacted by your illness or you're impacted by their illness, perhaps, I think the important thing to know is that we all cope differently and we all go through different emotions, and those emotions might come at different times. So, if Seth and I were in a family up here, Seth feels angry one day and I might feel sad, and then there's a mismatch of emotions and it can present some communication challenges, and so or misunderstandings. So I think it's really important to know that to try to have empathy and compassion for your loved ones and what they might be going through, as well as, seek out the support that you need for yourself too.
And I also find it very important to have that open conversation with your family and friends. When I tested, I told a few of my good friends. I was very fortunate to have that support system, but it took me 3 years to tell my dad and my sister that, hey, I tested positive. I just wanted to let you know. And one of the biggest things was trying to protect them. I'm a big family person. I just didn't want them to worry about me. I didn't want them to just add more pressure to their life and feel like that burden to them, because they were already dealing with my mom. And most importantly, I just didn't want my mom to ever find out. Luckily, she didn't, because I didn't want to put that on her plate and make her feel guilty. But if I could go back in time, I definitely would have told them from the beginning, because after telling them, I finally got rid of that deep, dark secret, and I just felt like I could be myself again and be comfortable, and just understand that family support is huge when going through a decision, whether it's testing or deciding whether or not to join a clinical trial or to do a treatment or anything that's a big decision in your life. Having, the support from family as well as friends is going to help make things more manageable in the long run. And I learned that from my own personal experience, and so that's why I stress to everyone else, I say, don't do what I do. Make sure you talk to your family. Yes, friends are great, but it's good to have more than just friends for that support system.
Yeah, I guess the only thing I would add to that really quick is as Seth is saying, sometimes we don't feel comfortable talking to our loved ones, or we hold back. And I think that that's really common. We don't want to burden people. We don't want to do harm to anyone else. And at the same time, by not being honest with our own feelings or what's going on, that's a big burden to carry. And it becomes a much bigger burden keeping it a secret, like Seth is talking about. So. So I'll talk a little bit about how stress impacts somebody living with a rare disease. So, we all experience stress from time to time, and I think we can all get a sense, just like looking at the word stress, of what that might feel like. What actually goes on inside our bodies is that when we become stressed out, our body goes into fight or flight mode often, and we either want to run away from what's happening, or we want to kind of, put on our boxing gloves and get ready for a battle. And oftentimes that discomfort in the body, or it can feel like discomfort, can really aggravate symptoms of diseases. And I'll be clear, not to say that it's a cause for any illness that's out there. We haven't seen that at all in the research. But it can really exacerbate symptoms, or if you're already feeling bad and then you have stress piled on top of that, it can really contribute to what's happening in the body, and in the mind as well. And it just make it harder for people to cope, I would say.
Yeah, no, it definitely makes it harder to cope. Stress is just a big thing that everyone deals with from time to time. It's just, how do you bounce back from that? How do you get to that next part of your life to realize, I need to go talk to someone about this, or I need to go work it off, work out and work off that stress. For me personally, it's just, again, I always try to do things solo, and just, I don't want people to worry about me. Again, I don't want to be that burden. I want to take the pressure off my friends and family from worrying about me, which is very unhealthy. And I learned that because I thought I was doing I can say the word diligence. It's still early. But what I realized was I really was just hurting myself more because I wasn't being honest with myself and I wasn't being honest with them about having some stressful days and stressful times and then expressing it. I would hold it in and try to be that strong person for everyone else and then deal with it on my own time. And I would let it all out at once. And it's important to, let it out when you need to let it out. Whether it's just randomly, you need a good cry, or you need to just let some steam off. I think we really just need to appreciate taking care of ourselves before we try to take care of others who are in need. Because if we don't take care of ourselves, it's going to be a lot tougher in the long run.
And as Seth was saying before, I think it's really important to let ourselves be vulnerable. I don't know if anyone's familiar with Brene Brown's work. She's a social work professor in Houston, and she's done a lot of research around shame and vulnerability and what makes people kind of content in their lives. And it's not that these people don't have any stressors. It's just they perceive their stress in a certain way, or they figure out how to cope with it when they do have adversities, and they have support systems and they put things in place that help them to be able to cope better.
Allison, could you talk more about the additional health and mental health challenges that, just complicate the emotional health of the rare disease patient?
Yeah, absolutely. So I think for a lot of folks who get diagnosed with a rare disease or even a chronic illness, oftentimes there have been other health challenges before that. And so all of a sudden you're not just dealing with one health challenge, but you've got another one on top of it. And maybe it's about figuring out which medications will work together, or it might be about you have to do one thing to manage this illness, but you have to do something else to manage the other. And so it just adds more layers of complexity to it. And also, mental health wise, if somebody is experiencing depression or bipolar disorder or schizophrenia, some more significant mental health challenges, and then they get diagnosed with a rare disease or chronic illness, that can make it difficult for that person to cope. It can make it difficult for that person to follow treatment regimens or attend doctor's appointments. So it just adds so much to the experience for the patient. And so I think what I would say to that is that it's even more important to get supports in place to be of, as great of help to yourself as you can, if that's the case.
And for the last question, for some of the other emotions that people may be dealing with, I know we touched upon, grief and loss, anxiety, depression, stress, but some things that stand out for me that I've dealt with was anger, frustration, and embarrassment, lack of self-confidence. And for each of those, they each have, I guess, their own unique story, but the embarrassment aspect was more growing up with my mom and people judging her, judging me, judging my family, being embarrassed out in public with her, not having friends over at the house because I didn't want them to see her like that. I didn't know how they would react. And even just sometimes feeling that self-conscious of who's gonna look at her differently, who's gonna look at me differently because they think that I'm gonna get sick overnight, and then that's that. Anger and frustration, again mentioned, is why did this happen to my family? Being in denial at a young age, still at times being like angry and frustrated at myself if I drop something or forget something, and I think this has to be the HD versus I'm just being a typical young person or person who forgets something or drops something. But in the back of my mind, I'm always thinking, is this a symptom or is this just me being me? And finally, with the lack of self-confidence kind of comes into play when talking to other people about Huntington's disease and them either understanding it or not understanding it at all, especially when it comes to romantic relationships. When do I bring this up in a relationship? Do I say, hi, I'm Seth, I tested positive? Or do I wait until 6 months to a year down the road and then they're like, whoa, actually, I don't want to do this. So that's another challenge of then do I push them away because I'm like, oh, this has to be because of the Huntington's disease. They can't deal with it. And how to go about that is definitely tough. But I realize I need to just remind myself that I can't define myself by Huntington's, but by who I am as a person and my personality as a whole. So still plugging away on the single train. Don't worry, guys.
So I would just add to what Seth said, other emotions that folks might experience, things like shame or guilt, being like he talked about embarrassment of either the way you look or who you feel like you are with a rare disease can really be common for folks. And then the guilt, not being able to be the person for your loved ones that you wish you could be. You wish you could do more. You wish you could be there for them in different ways, but you're just not able to do that either for physical or emotional or cognitive reasons. And that can be really hard on folks. And I think ties into some of that self-confidence that Seth was talking about. You feel like we all have this expectation of the kind of person that we want to be. And when you have different adversities that you're facing, physically or otherwise, it can really get in the way of being able to be that person.
All right. So I know that we're running a little short on time because we want to make sure we have enough time for Q&A because this is about all of you and what we can do to give any type of professional advice or personal advice. So just to jump through these real quick, Allison, do you want to briefly go over types of professionals or peers
Absolutely.
that can help when it comes to rare diseases?
Sure. Yeah, so there are a lot of different kinds of professionals out there. If you live with a rare disease, you most likely see some kind of medical professional, doctor, MD, maybe a nurse practitioner. Those folks can be really supportive, but there are also a lot of other types of healthcare professionals that can be helpful to see. So like Seth talked about earlier, a psychiatrist. So a lot of times folks are confused about what's the difference between a psychologist and a psychiatrist. So a psychiatrist is an MD. It's somebody who's gone to medical school and specialized in psychiatry, so in mental health, basically. And psychiatrists are the ones who have the ability to prescribe medications. And Seth and I had a conversation earlier. I said, I kind of get up on my high horse a little bit when folks talk about how their primary care docs have prescribed antidepressants or anti-anxiety meds, and I cringe a little bit because primary care docs are great. They do have the ability to screen for things like depression. But if you really are struggling, it can be helpful to see somebody who really specializes and understands the different types of antidepressants and really get on the one that's right for you. So I'll say that with caveat. Additionally, so psychologists, licensed clinical social workers like myself, licensed mental health counselors. There are different licenses in different states for mental health professionals. And so some of the language I'm using might not be consistent with your particular state, so just be aware of that. I would also add to that licensed marriage and family therapists. Sometimes all of those individuals can offer therapy, can be resource to folks who are struggling or need that emotional support.
And just to add to that, again, just make sure you do your research. As I mentioned, I went to a bunch of different therapists when I was growing up, and they just never worked out, and that's fine. But I didn't do my research beforehand to find a psychiatrist that understood what anxiety was or what depression is. And then now there's opportunities for me to even go talk to someone who's a psychiatrist and understands Huntington's disease to some extent. So really doing your research is very important.
And I'll add to that, some psychiatrists do also do therapy in addition to prescribing meds. And so if you're looking for both, that can be a nice supplement. What was I going to say? Yeah, I'll just leave it at that.
Now, in regards to meeting other people who understand what it's like living with a rare disease, this is a great place to do it. Going to Global Genes or going to the NORD Summit that's coming up in a few weeks, which NORD stands for National Organization for Rare Disorders, but also reaching out to people within your own community. I think that's very important to just try to find them, connect with them, and figure out what those next steps are. You could check out your own specific patient advocacy organization. You could come reach out to us. One thing that I want to do, and I'm going to do this today, is I want to meet young people here at Global Genes. I want to connect with them. I want to start that conversation because a lot of them don't have the necessary support or needs that maybe an older adult has. So, at 4:30, by the bar lounge area, I'm wanting any young person who's here to come meet by the bar. Exactly. That's how we deal with our stress. But yeah, by that bar area, the lounge area, just to start that conversation up, to have that dialogue. So if you are a young person, you want to come connect and meet other great young people in the rare disease and chronic condition communities, come check it out. I think. Define young. Everyone's young at heart, but come talk to me after. We'll talk about it.
So I remembered what I was going to say a minute ago, jumping back to the more professional support side of things. Something that was brought up in this room yesterday when they were doing the presentation about families is about when you're seeking out, when you do your Google search and look for a therapist, don't type in rare disease therapist because that's not a language that we actually use in the counseling community. You might look for a chronic illness therapist or a grief therapist, or as Seth mentioned, if you're looking to see somebody for depression or anxiety, it can be helpful to type in some of those kind of keywords. And just the last thing I'll add at the end here, I know we're just about out of time. So at the Center for Chronic Illness, as I mentioned at the beginning, we do offer now web-based free support groups. And I've got some flyers up here. I don't know if folks want me to pass them around. I'm happy to do that. You can also visit our website, Center for Chronic Illness, www.thecenterforchronicillness.org. Just toss that out there. And you can read about our web-based programs and how to sign up on there as well. We have a rare support group online, but we also have a rare support group in Seattle. So if we have any Seattleites in the room, you're welcome to come grab some flyers too.
All right.
Now the fun part.
Yeah. So if any of you have any questions, just raise your hand and I'll bring you the microphone. Thank you, guys. That was great.
Thank you. Hi, Seth. First off, I'm very sorry for your loss. I have a nephew who has a rare disease. Recently lost his mother, two totally different situations. She didn't have a rare disease, she had breast cancer. So did you find that social media was better for you, or was in the beginning to reach out when you needed help, or like contact face-to-face with your friends?
I think it really depends. When I was growing up, we didn't have the Facebook, Instagram. I'm not that old, but I was all about the AOL chat rooms, which was pretty cool, and I still miss those. But I think social media is so big now that you can search for people who are, maybe there's a support group for young people impacted by, or survivors of breast cancer, or caregivers. There's so much out there. I think, though, the starting point is seeing what he wants. It's understanding what his needs are, what's going to help him feel better about himself. Because no matter how much we can push on each other and say, you need to do this, we got to figure out what do they want, and understanding what their interests are. And if they do want to find some type of support, say, hey, here's some resources I found for you. Or are you talking to some friends? Or how can I help? Just listen to you.
And if I can add to that really quick, I would just say regarding social media, I think there are some really great peer supports out there. Seeing a lot of great Facebook groups for different chronic illnesses, different rare diseases. Also, Instagram, for some reason, it has a huge chronic illness population, and people seem to be pretty comfortable kind of sharing pictures of their life with chronic illness, which has been really interesting to see as an organization. But what I would say is that sometimes those peer supports aren't moderated by people who know the facts. And so what I would say is just take what you read or what you participate in with a grain of salt, because there can be a lot of misinformation out there. And I think it can lead to a lot of self-blame or shame, if there's a sense of, well, I did this and this worked for me, and then somebody else tries it and it doesn't work for them, and then they're like, well, what's wrong with me? You know, what did I do wrong? And why can't my illness be fixed or cured? I think we see a lot of that language in those kinds of groups, unfortunately. So, yeah, again, with that caveat. Yeah, so with it being online, really anybody anywhere can access it. Again, I've got flyers up here, so please come up and grab one if you're interested. I think the nice thing about our programs, which are a little bit different, is that they are professionally led, and so there's some kind of psychoeducational tools being taught, as well as kind of the creation of a safe place just for people to be able to share and kind of share their personal experiences without the pressure of, well, you need to try this or you should do that because that's what worked for me. So.
So what advice would you have for a parent who maybe acknowledges or has concerns for their child, but their child is hesitant to, partake in therapy? It's something that the parent's wanting, the child's not. How do you navigate that relationship?
That's a really great question, because I think, I don't know how old the child is you're talking about, but I think as kids get older, they tend to get more rebellious and resistant to the things that their parents suggest. Yeah, I think that, as Seth was saying before, we can't force folks to do the things that we think that they should do. We can, as parents, that gets a little more complicated because you feel like you know what's best for your kid, and you probably do a lot of the time. But yeah, it can be difficult to kind of force them into that therapeutic relationship. I mean, you could make a deal with them and say, I need you to try it one time and see what you think. You could let them, if they're old enough, you could let them pick their own therapist or support. So I think kind of giving them the power in that situation, if you are noticing some resistance. You could also give them options. You could join a Facebook group, or you could go see somebody individually, or you need to pick up one of your friends you can talk to about it. So you can kind of give them multiple options and give them a sense of control over that decision.
And don't be afraid to just not like nag them, but just see how they're doing. I definitely think having these conversations at a younger age will be easier. Growing up myself, I learned at 15, and it was during my teenage where I was, all those hormones and everything I had to deal with.
Yeah.
So it's definitely, I think, tougher as someone gets older to accept it and acknowledge it versus if they're younger, yes, they're going to be rebellious, but I think eventually they're going to accept it and understand and say, well, now I want to do something about it. I want to learn. I'm finally accepted it, and I want to make a difference. But again, making sure he has a safe place to go, whether it's talking with you or talking to a friend or someone that can support him through his journey.
I am 64. I had an illness at 12 that set off a whole bunch of different things and I would have periods in my life when I could get more done, and then periods where I wasn't really getting hardly anything done. And I'm self-employed. I'm at this point, all of us, like it seems to hit a crescendo all of a sudden where people don't seem to accept the fact that I'm disabled. For instance, I had several years of back taxes to prepare and file, and my CPA said basically, screw you. He's been my CPA for 20 years. He doesn't want to deal with more than a couple of, maybe 2 years or so at a time. And I was sick for so many years that it just didn't happen. The one thing that I'm able to do that I get a lot of enjoyment out is competing with my dogs in dock jumping. I literally got a letter just yesterday chastising me for entering events and then backing out of them, even though there's a provision. Thank you for shaking your head. I'm glad to not be alone in this. There's a provision where, there's a deadline by which you can scratch out of an event. I have never violated that, but I get this nasty letter. Maybe you should rethink what organization you're jumping your dogs with. And I'm, in my head, I've already prepared the dang letter I'm going to write when I get home saying, I'm sorry, when I'm not able to go to an event, you don't want me there, and I don't need to be spending my money trying to do something I'm physically not able to do. Anyway, those are just two examples of things that have come up lately where the lack of understanding is pretty appalling. And yeah, I don't have crutches or a wheelchair, you know, and very few people I've seen at this entire conference do. But, you know, I know there's a lot of us here that do have the hidden issues, disabilities, and being accepting of that yourself, being able to articulate that yourself, knowing where you would think supportive people are isn't necessarily enough to help you catch up with a backlog of things that inevitably seems to happen when you go through cycles and you just can't keep up with your own life. So I guess the question out of all of that is, what do you do? Where do you go? I'm coping. I don't have any choice other than to cope. I can't give up. I got to keep pressing on. I'm tired of fighting. I'm tired of having to explain. The dock jumping organization doesn't have a single ADA compliant thing going on for them. I feel like throwing that in their face. Anyway, that's it. Basically, in a nutshell, is I feel like I'm falling further and further behind in my life, and it's all starting to catch up with me, and there's not enough acceptance of that to just ride it out with me while I try to catch up.
I think that what you're talking about is one of the reasons why it can be so isolating to live with a rare disease or any kind of chronic illness, because a lot of folks out there don't get it, and there are a lot of myths or misconceptions or judgments about what it is like to live with an illness. And I don't think I said this already, but oftentimes the general community understands what it's like to live with an acute illness. You know, our society is set up to understand the flu, you feel sick for a week and then you get better, or you get a cold, you feel sick, then you get better, you break your arm, it heals, then you're better, and so there's this real lack of understanding about what it's like living with something that's ongoing. And I think, I'm sorry to hear that you've had to deal with some difficult people. I'm almost wondering if there's any kind of an advocacy organization out there, I don't know if Seth's aware of that, but perhaps that might be able to write a letter on your behalf that you can send with your letter, or, something to try to educate them. It's really unfortunate that they don't even have ADA compliant events. It's terrible. That's a great idea.
Yeah, I think just like, there's a lot of people here that I'm sure could relate to some extent of dealing with some crappy situations, or people just not understanding no matter how much you educate them about it. And so, perfect. Someone gave you a card. So that's exactly it, and that's, I think, why it's important for us to connect with each other and chat with each other about these situations, so we can figure out if someone has gone through that or similar circumstance. Maybe they found a way around it that they can now talk to you about. Maybe there's someone out there that has either gone through it or is going through the same thing, and maybe there's a way to brainstorm and figure out the best option, the best solution to go through this. But there are advocacy organizations out there. Several of them.
Well, I think so, because then it's not just your battle that you're fighting all by yourself, and you're this person that they can just put off and say, well, she doesn't know what she's talking about, or she's this, or she's that. But then you have an actual organization and a disease community backing you up.
Yeah, a few of them, Every Life Foundation, they have a booth here, and then there's NORD as well that does some policy work, and I'm happy to connect you with the right people there that can hopefully try to help out in some capacity. But
The other thing I would add is fire your CPA if you haven't already. Sometimes there are just going to be people like Seth says that don't get it. Find the people that get it and that are kind and that are willing to work with you. There are tons of CPAs out there, so I'm hopeful that you'll be able to find somebody if you haven't already. Yeah. Sure. Yeah.
So I know that we're running out of time, but if people do have like questions, come up to us.
Feel free to come.
We're happy to answer anything. But thank you guys again for coming to this. I hope to see some of you young people 4:30 by the bar. Maybe I'll buy the first round. We'll see.
So thank you, Allison and Seth, for the great discussion. It was really awesome. And so at this time, we'd like to ask you to jump onto your mobile app, and if you could please take the brief survey about the session, and then enjoy our networking break. It's going to be sponsored by Spark Therapeutics. So our next breakout session will be at 11:30. Thank you for coming.